Good morning. My name is Jamie Moses. I'm your invigilator for the OET speaking test, conducting on the 15th of January 2021. Can you say your name for the record, please?
Good morning, Jamie. My name is Levi Joshua.
And what is your candidate number, please?
My candidate number is 213163970.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes. Correct.
Thank you. Can I see your ID, please?
Yes, of course.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
Do you have any career goals?
5 years from now, I aim to complete a postgraduate degree in oncology nursing. I will spend the next 2 years mastering all the skills of being an onco nurse. I will get additional certifications and possibly pursue a master's degree in a university to further my knowledge and skills on the job.
Being an oncology nurse, you require to handle confidential information on a regular basis. How will you maintain your patients' privacy and build trust with them?
My initial goal will be to let both the patients and their families know that any and all medical information discussed during our meetings is entirely confidential. I've found that informing them of the hospital's policy on sharing information and my position in regards to said policy is an excellent way to build trust between us and create a foundation of honesty that's necessary for the proper treatment of a patient. I would uphold my promise to keep my patient's information secret, regardless of the circumstances. I take pride in my work, and helping patients to feel comfortable while undergoing treatment is one of my top priorities, and something that I take very seriously.
When faced with an upsetting situation, what is your first reaction?
In this line of work, stressful situations are bound to arise, particularly in the oncology field. When I'm upset, my first reaction is to take a deep breath and get my emotions under control before speaking or acting. It's always important to remember that the patients and their families who are confronting you are more upset than you are, and that coworkers are dealing with the same amount of stress as well. Remaining calm is always my top priority in these situations.
This position can sometimes call for erratic hours and overtime. Would you be willing and able to perform duties on short notice?
Yes, definitely. While I think it's important to maintain a work-life balance in any career, I know my services may be required at a moment's notice in order to ensure patients are receiving the care they need throughout the treatment process. As long as I'm helping patients and their families, I'm willing to work any hours I need to.
Would you say that you have good communication skills?
Yes, I believe I have exceptional communication skills. In my last position, I was regularly required to communicate news to patients and their families regarding oftentimes sensitive information. There were times when this was challenging, but as I continued with my career, I learned how to handle these situations with ease, and how to keep a level head when discussing treatments, procedures, and other information with patients. I know these skills will help me to make any hospital I work a more comfortable and efficient place for patients.
Great. Thank you very much for sharing that. So, let's move on to the role plays now. I'll take the part of the patient, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. Now you can start your role play. Don't worry if I stop the role play when the time is up.
Hello. Good morning, Nina. Myself, Levi Joshua. I am a registered nurse working in this facility, and I will be looking after you this morning. How are you doing today?
Hi, nurse. Good morning. I'm okay today.
All right, I am glad to hear that. By the way, the doctor handed over me your test result. And I am here to inform you regarding that.
Oh. Is it? I'm curious to know about it.
Is it the right time to discuss the report with you?
Yeah. Of course. You may please.
Thank you. Well, Nina, there are blocks in your coronary arteries. Hence, a surgery is needed.
Of God. Nurse, are the blocks very critical?
Unfortunately, I am really sorry to inform you that you have almost 6 blocks in your coronary artery. For your information, the blocks are caused by high levels of blood fat. Therefore, you need to undergo a surgical procedure for the removal of the obstruction.
Oh my God. 6 blocks. And another surgery. Oh no.
Yes, I can understand your situation. I know 6 months ago you had a coronary artery bypass graft, followed by a full recovery. However, surgery is mandatory to remove your blocks now.
Is it the same surgery I had earlier?
No, now the doctors have advised for balloon angioplasty.
May I know, balloon angioplasty, in detail please?
Balloon angioplasty is a minimal invasive procedure. During the procedure, a specially designed catheter with a tiny balloon is carefully guided through the artery to the blockage, then inflated to widen the opening and increase blood flow to the heart. A stent is often placed during the procedure to keep the artery open after the balloon is deflated and removed. Am I clear to you?
Yes, you are.
Thank you. If you don't mind, can I ask you a few personal questions for my better knowledge?
Okay. I'll answer you.
Great. So, what kind of food you prefer to eat?
Well, I follow a mixed diet, but I prefer to eat fast food, as I have felt that those food items are tastier.
Yes, I do acknowledge your point that takeaway dishes are tastier. Even though, most takeaway food contains high levels of sugar, salt, and fat which cannot be considered as healthy. They will increase your blood fat levels. So, I suggest you cook more healthy food for yourself.
Being alone, I really don't prefer to cook food.
Sure, I realize your concern, if you really don't like cooking. I could arrange Meals on Wheels for you. They offer healthy food. Healthy food is those full of fibers, like wholemeal bread, fruits, and vegetables, especially green ones. Not too much meat with less salt, sugar, and fat. Is it okay for you?
Oh, I think I can put that into consideration.
Glad to hear that. By the way, do you smoke or drink?
I don't drink, but I smoke.
Okay. Would you mind telling me how many cigarettes you smoke a day?
I am happy to let you know that I have reduced the cigarettes consumption in a day. Before, it was around 20, and now, I smoke only 10 cigarettes a day.
I really appreciate the effort you put to lessen the number of cigarettes you consume. Nevertheless, it is very much essential to cease the smoking habit.
It's just 10 a day. I know it's not healthy. Well, I'll put my effort into reducing the count.
Decreasing the count is not a perfect solution at this point in time. The only remedy is to quit smoking cigarettes. Are you ready to follow my instructions?
Yes, I understand the need of quitting cigarette smoking. I know it will be challenging for me, but I can try my level best.
I am happy to hear that. First of all, I would like to inform you about the alternatives available in the market to stop smoking, such as nicotine gums, electronic cigarettes, and even with the prescription of a doctor, you can avail of nicotine patches from the hospital pharmacy. These can help you to stop smoking slowly, without any further withdrawal symptoms. Am I clear for you?
That information is new to me, and is really helpful.
All right, but before everything, you need to acquire a strong determination, and fix a definite date in mind to stop smoking. If you quit smoking, you will have more energy, better health, an improved sense of taste and smell. Does that sound realistic to you?
Yes, I can imagine how it will be. And also, I realize the essence of life that I missed so far.
Thank you for understanding my words.
Pleasure is mine. Talking to you gives me more reasons to live a healthy lifestyle.
Another thing I would like to mention is that there are many support groups and programs available in the community health center, which helps to quit smoking. You can make use of these groups after the discharge.
All right. That will be helpful for me.
Finally, I would like to know about your exercise routine. Is it okay to share with me?
I feel so sorry to say, I am not following any exercise or other body maintenance practices.
Oh. So it's a must to start doing exercises. Exercises are very important. Even a small amount of exercise every day will benefit you. Exercise would reduce blood fat, make your blood pressure in good levels, and make your muscles stronger, including the muscles in your blood vessel walls. You can do exercises inside your home such as walking for 5 to 10 minutes, yoga, jogging, and also, you can join an lawn bowls club. That could help a lot.
It's not my cup of tea.
Most people in your situation feel the same way. I know you are afraid of further heart problems due to exercise. No worries, I would refer you to a physical therapist, who will design a special exercise plan according to your own situation and give you special instructions. Sounds good, isn't it?
All right, I think I can go for a try. Thank you for your consideration and care.
Great. Do you have any other questions for me?
No. I have received a whole load of eye-opening information. I'm very thankful to you. God bless you.
Thank you. Now I leave you to have a rest. Here is the bell. If you need me, please do not hesitate to give me a buzz. Remember, we are always here for help. See you later. Get well soon.
Thank you.
You are welcome.
That is the end of your OHT speaking test. All the best.
Thank you.
Thank you for watching. Please like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.